Hi, and welcome to the video module on dry eye clinic. This is a fun session to have, but before we get into the actual practical side of what is happening in the dry eye clinic, I thought I wanted to take you guys just through the meibomian gland scan on the MediWork slit lamp. It's important that you know what the system and the meibomian gland system looks like before you actually plan on treating this gland system. No point of actually expressing a gland that's no longer there. So let me show you how we can actually utilize the slit lamp to our advantage. So firstly, you're going to put the patient behind the slit lamp. Always get them to put their head all the way to the front. Now on the software, you want to switch over from your normal light source to your infrared light source. So you're just going to click your infrared button and it's going to automatically throw you over to your infrared light source. You want to close off your beam light, okay, and zoom into the patient's eye, and you'll see that it actually comes nicely into focus there, okay? All you do then is you want to invert the lid, so you're going to have a look at the bottom as well as the top lid. So with the bottom lid, you just use your finger to actually push onto the bottom lid. Don't just pull it up, but push into the globe, and you'll see that the lower lid kind of everts towards you. Bring your slit lamp a little bit lower down, and there you will see that you've got a very nice infrared photo. You can see your whole gland system, and with this patient you can see that the glands are actually looking quite good. Also do the top lid. Patient will look down, take the eyelashes and use an earbud, and what you do is you pull on the lashes slightly, push the earbud into the lid and just flip it over. So there you're looking at the top lid. Again, focus your slit lamp onto that lid structure. And if you want to avoid that glare that you're getting there, just kind of release the lid a little bit and you'll see the gland structure very, very nicely. All right, so now you've got a nice photo of the patient's meibomian gland scans, infrared photo, and you know exactly where the problems lie. Remember what we're looking for? We're looking for shortened glands, lightened glands, or any abnormalities that you find within the gland structure. If there's no gland, if it's just a pure blank space, please do not try and express that area when you are doing your dry eye clinic, because you are just going to frustrate yourself and it's going to be painful for the patient because there's nothing that's going to come out of there. So let's focus on the gland structure that still exists. Okay, so going into the dry eye clinic, firstly, what is the dry eye clinic? The dry eye clinic is just an in-depth heat and expression session that you do within your office to manage meibomian gland dysfunction. So the procedures that it involves is, number one, a heat mask. Now, I personally use the Blefasteem mask. Blefasteem is a plug-in heat release mask that keeps a steady state of temperature for 10 minutes without stopping. So how the mask works is you plug it in. It takes about 15 minutes to warm up, so make sure that you do that in advance before the patient comes into office. You take rings. The rings look like this. Okay, this is the thing that creates the steam or creates the moisture in the mask. What you want to do is you want to actually take some saline and you're actually just going to wet your rings. So you take the saline and you just go and you wet the ring. Get it nice and soaked with fluid, with saline, preferably non-preserved saline, and that ring just goes straight into your mask, into your eyepiece like that. And then the other one on the other side. Okay, so once that is done, this goes onto the patient's face and it gets attached to the back of the head. So let me show you what that looks like. You pop it onto the patient's face. The main thing is that you want to make sure that you create a little bit of suction. So you press a little bit into it. Get the strap to go around the head. Okay, please hold on to the front for me. Patient can hold onto the front while you do this, and you just attach the strap to the back.